Hello and welcome to our YouTube channel Infomeds. Today in this video we will discuss azithromycin capsules 500 mg or 250 mg. Uses, side effects, and dosages. Azithromycin is used to treat a wide variety of bacterial infections. It is a macrolide-type antibiotic, which works by stopping the growth of bacteria. This medication will not work for viral infections, such as the common cold, or flu, etc., as infections like viral need to be used antiviral drugs like acyclovir, etc. Why is this medication prescribed? Azithromycin is used to treat certain bacterial infections, such as bronchitis, pneumonia, sexually transmitted diseases, STD, and infections of the ears, lungs, sinuses, skin, throat, and reproductive organs. Azithromycin is also used sometimes to treat H. pylori infection, traveler's diarrhea, and other gastrointestinal infections. Legionnaires, a type of lung infection. Pertussis, whooping cough, a serious infection that can cause severe coughing. Lyme disease, an infection that may develop after a person is bitten by a tick. And babesiosis, an infectious disease carried by ticks. It is also used to prevent heart infections in people having dental or other procedures. What side effects can this medication cause? Azithromycin may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away: nausea, diarrhea, vomiting, stomach pain, headache. Some side effects can be serious. If you experience any of these symptoms, stop taking azithromycin and call your doctor immediately or get emergency medical treatment. Fast, pounding, or irregular heartbeat. Dizziness. Fever and pus-filled, blister-like sores, redness, and swelling of the skin. Hives. Itching. Wheezing or difficulty breathing or swallowing. Swelling of the face, throat, tongue, lips, etc. Vomiting or irritability while feeding. Severe diarrhea, watery or bloody stools. Unusual bleeding or bruising. How to take it? Azithromycin. Azithromycin is a prescription medication. Therefore, people should not take it without a prescription. What is the dosage? 1. For community-acquired pneumonia, tonsillitis, and skin infections. The initial dose of 500 mg, mg, followed by 250 mg once daily until day 5. 2. Mild to moderate bacterial COPD exacerbations 500 mg per day for 3 days. OR an initial dose of 500 mg followed by 250 mg once daily until day 5. 3. Sinus infections 500 mg per day for 3 days. 4. For genital ulcers a single dose of 1 gram, g. 5. Urethritis cervicitis a single dose of 1 gram. 6. Gonococcal urethritis cervicitis a single dose of 2 grams. Using antibiotics incorrectly can lead trusted source to the development of drug-resistant strains of bacteria, meaning that antibiotics no longer work against them. So don't use any antibiotic without a doctor's prescription. It was a little bit about azithromycin capsule. Hope you liked the video. If you have liked the video, please do subscribe to my channel Infomeds. Thanks, see you next, take care.